everybody. My name is Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri. Welcome to our channel, J&J House Call. This is my wife.
Hi, I'm Dr. Jennifer Su. I practice conventional gynecology and integrative medicine. We're so glad that you're back here with us again this Sunday. Today's topic is chelation therapy, why it's controversial, is it safe for us to do, and why do we use it in some cases. If you haven't subscribed, please consider doing so. We upload 2 videos a week. We absolutely love integrative medicine and talking about how to empower our bodies to heal itself. And always hit that notification bell right up there at the bottom and hit the like button. We appreciate it.
Right up there at the top, right?
Right up there at the top. Well, Mom said, why do you hit that? Or why do you hit the notification bell at the bottom? So the notification bell's down there, and then I have to hit that just to make it bing.
Yes, you want to say that again?
No, I don't want to say it.
Really, it involves a complex chemical reaction with one substance with a metal, and what that does, it allows the metal to be excreted or mobilized from whatever tissue it's in. So that's where the word chelation comes from. Now, I first became aware of the topic when I was a member of the Board of Healing Arts in Missouri, which is a licensing board for physicians and physician assistants. And we had one particular physician who was using chelation therapy, and it came to the attention of the licensing board because of some of the claims being made by that physician saying that it cured peripheral vascular disease, heart disease, autism, Alzheimer's, and to the extent that it actually worked better than conventional medicine. And that's kind of where the problem began, because some of the patients started going and using chelation therapy when they should have been using conventional medicine. There were some deaths. Now, not to say that there haven't been some positive studies with chelation therapy, and did you want to talk about those first, or?
Yeah, you've heard of it when kids, eat all the paint off these older homes and they get lead toxicity or higher lead levels. And this is very approved by the FDA for use in lead toxicity in children to get rid of the lead. And how it works is that you give them intravenous EDTA, and it just allows the child to excrete the lead out of their urine. And I think it started in the 1950s, and it's been approved since then for use for lead toxicity in children. And also, at the same time, they accidentally stumbled upon the fact that some people with atherosclerotic disease, which is just cholesterol buildup in their arteries, had some improvement of that getting EDTA. So more studies were done, and the most popular is the TACT trial.
Yeah, TACT stands for Trial to Assess Chelation Therapy. And what they discovered there's actually been 2 studies with that, and this is important, especially for people that are considering using it, is that they did get positive results for patients. In the first study, the patients had already had a heart attack and were already on conventional medicine. They introduced EDTA as well as high-dose vitamins, and they found that there was actually a modest reduction in cardiac revascularization procedures later on within 5 years, and this carried out through 5 years. But they didn't find that the studies were strong enough to recommend it on a routine basis. Then they did a second study, the second TACT study, which looked at diabetics and people who had had heart attacks, and they did the same thing. And again, they found that the studies are very similar. There was a modest improvement in the course of the disease, but again, it wasn't quite strong enough to recommend it. Now, unfortunately, if you look at the studies, all of them included, they threw in, not just EDTA, but there were some other components, high vitamin C and B vitamins and so on. And it's hard to kind of tease out. None of these studies were meant to really tease out what the effects of those other components in the IVs were as well. So so it's still remains somewhat confusing. Some individuals do want this kind of treatment, and they really should consider it. as a very last resort. So in other words, if you cannot tolerate some of the conventional medicines for whatever reason, or you have some type of objection to using them, just be aware that it's really conventional medicine has much stronger evidence for use with atherosclerotic heart disease. Now, again, as I mentioned, the TAC study was really done on patients who had already had a heart attack. So there's really no studies been done on prevention. So if you haven't had the event now, and you don't have a documented disease, no one's really ever actually looked at that to see if it actually delays the progress of the disease. Yeah, and there are some side effects that can occur with it as well.
So really, there are integrative practitioners like us that do chelation therapy. We're using doses that are safe in their standard protocols, but they're lower doses than any of the doses that caused death in some of the cases in the past. So what we're doing is very safe.
Yeah. And there have been reported deaths with EDTA, and people that are considering this need to know that if they're going to receive it, they should be receiving it by a trained medical professional, and that it should not be bolus. In other words, should not be given rapidly, because that's when all the deaths occurred, all the adverse events occurred when you gave EDTA very, very quickly, and that's because it precipitously can drop your calcium levels.
And what he brings up is really important, because your doctor that does this will know the difference, but there's two types of EDTA, and the type he's talking about is disodium EDTA without the calcium. The other type is disodium EDTA with calcium. It's called calcium disodium EDTA. Mm-hmm. Very, very confusing, because the only difference is one has calcium, one doesn't. Just remember, the calcium one does not have any of those bad side effects that he talked about with death, with rapid infusion. But the one without the calcium is also used when we have given a patient too much digitalis and they have intoxication by it, or if maybe they took too much of a dose and they have digitalis intoxication with elevated calcium levels. That's a very useful treatment to bring down those calcium levels, and that's safe in those cases.
Yeah. And if you looked at the TAC study, used the form of EDTA that does not have calcium.
Interestingly, and they used it safely.
Yep.
So I guess the bottom line is it's safe if done knowledgeably and correctly, but there's a lot more studies that have to be done just so that we can really recommend that, and if you've had a heart attack, that you can routinely use IV chelation therapy with EDTA to help your heart disease. Right now, there's not enough evidence to really show that you really can use it routinely in place of your conventional doctors wanting you to get on all these medications or strategies to help prevent another heart attack.
Now, it's important to learn too, in addition to using EDTA, you really, if a person's considering this and you're going to do it on a long-term basis, not occasional basis, but long-term, and you really should have some basic metabolic profiles, blood work done on you to make sure you have a very healthy baseline to start off with, because it can affect some of the components in your blood.
The reason he's bringing up all the blood testing is that when we chelate the bad heavy metals, we have naturally occurring heavy metals in our body, like zinc and copper and iron. So whenever we give IV chelation therapy, you have to really monitor zinc levels, calcium levels, iron levels.
Now, if you're looking at EDTA for a way to detoxify your body or get rid of some of the metals you don't need, understand that there are some other approaches as well. Now, why do we need this to happen? Well, our body, when it processes our fats, proteins, and carbohydrates, it goes through a cycle, and it actually has some toxic byproducts that need to be excreted. Okay, so some of those are some of the metals that live in a balance in our system, and we need some of these other components, like something called glutathione. And these are natural chelators. Okay, they actually bind some of these toxic components and help our bodies excrete them. Some other well-known chelators include N-acetylcysteine and taurine and selenium. So these are all components that in our blood as well. They are actually improving the process of our getting rid of toxic chemicals. In other words, they're antioxidants. So chelation is always even occurring in our body, whether we give it a EDTA or not. We're actually going through this process anyways. So some of the other things that we can use as well that are more natural is blue-green algae. That has been known to have positive effects as well, and it's very healthy. Spirulina is one of the most common. Other chelators include alpha-lipoic acid, which also can be given intravenously, brain, and melatonin, interestingly enough. Now, I should give you a word of caution with melatonin as well, because people often know, and we've done a video on that as well when we discuss sleep. I just came across a study where it showed that people were actually using way too much, and I've seen doses in people up to 20 milligrams a day. And again, that is only indicated in very specific cases. If you just need it for sleep and you're just doing for just general overall health, people take between 1 to 5 milligrams a day. I've heard of other individuals taking even more. We were always taught we use it for sleep. We take an extended version, which actually lasts longer.
I think we should do. Would you all like us to do a video in the future about melatonin? Just comment below. I think it'd be kind of cool too.
Mm-hmm.
It seems like a lot of people are taking melatonin, and there's a lot out there. They just don't know what's a good dose.
Yeah, and it's being used for other things besides sleep.
There's 2 other pharmacologic agents besides EDTA. One is called DMPS, and it's not FDA approved, but it does help remove mercury. And one is called DMSA, and that one helps remove lead, mercury, arsenic, antimony, and cadmium. But with the DMSA, you have to monitor a patient's levels of zinc, copper, and sodium during the chelation process.
So I want to mention that flavonoids and phytochemicals are also a natural source of antioxidant therapies. And again, as I mentioned, antioxidants are important because they help us get rid of the bad toxic things that we make whenever we're processing and making energy. Green tea is a very common one. Various seeds, fruits, and flowers as well, and also other types of vegetables. Okay, in summary, when you hear the term chelation therapy, if you start thinking IV chelation therapy, understand that the studies are not very conclusive, and the thing that people most get excited about is the fact they think it can reverse atherosclerotic disease. Again, the studies have showed only modest improvement, and these have been in patients who have already had a heart attack and are already on conventional therapy as well. And but the studies weren't strong enough to say that it should be used on a routine basis. Now, if you're just looking for just kind of a natural way to approach detoxification and natural chelation, understand that certain things that actually do this already. So dietary fibers and sulfur-containing foods such as garlic, onion, and fruit pectins can do it as well. Thank you all for joining us today. Our midweek check-in, we're going to be talking about the benefits of dancing.
Yes, it's really easy. Literally everyone can dance. We're not talking about how the benefits of being a good dancer. Just get up and move.
So long, everybody.
See how you're in the middle? I'm not in there at all.
I think it looks fine. Sitting here on my pajamas.
I know. Look at mine. I'm freezing.